Without treatment, HIV advances in stages, overwhelming your immune system and getting worse over time. The 3 stages of HIV infection are: 1. Acute HIV infection, 2. Clinical latency, and 3. AIDS acquired immunodeficiency syndrome. However, there's good news. By using HIV medicines, called antiretroviral therapy or ART, consistently you can prevent HIV from progressing to AIDS. ART helps control the virus so that you can live a longer, healthier life and reduce the risk of transmitting HIV to others. These are the 3 stages of HIV infection. Within 2-4 weeks after HIV infection, many, but not all, people develop flu-like symptoms, often described as the worst flu ever. Symptoms can include fever, swollen glands, sore throat, rash, muscle and joint aches and pains, and headache. This is called acute retroviral syndrome (ARS), or primary HIV infection, and it's the body's natural response to the HIV infection. During this early period of infection, large amounts of virus are being produced in your body. The virus uses CD4 count to replicate and destroys them in the process. Because of this, your CD4 cells can fall rapidly. Eventually your immune response will begin to bring the level of virus in your body back down to a level called a viral set point, which is a relatively stable level of virus in your body. At this point, your CD4 count begins to increase, but it may not return to pre-infection levels. It may be particularly beneficial to your health to begin ART during this stage. During the acute HIV infection stage, you are at high risk of transmitting HIV to your sexual or drug-using partners because the levels of HIV in your bloodstream are very high. For this reason, it is very important to take steps to reduce your risk of transmission. After the acute stage of HIV infection, the disease moves into a stage called the clinical latency stage. Latency means a period where a virus is living or developing in a person without producing symptoms. During the clinical latency stage, people who are infected with HIV experience no symptoms, or only mild ones. This stage is sometimes called asymptomatic HIV infection or chronic HIV infection. During the clinical latency stage, the HIV virus continues to reproduce at very low levels, although it is still active. If you take ART, you may live with clinical latency for several decades because treatment helps keep the virus in check. Read more about HIV treatment. For people who are not on ART, the clinical latency stage lasts an average of 10 years, but some people may progress through this stage faster. People in this symptom-free stage are still able to transmit HIV to others, even if they are on ART, although ART greatly reduces the risk of transmission. If you have HIV and you are not on ART, then eventually your viral load will begin to rise and your CD4 count will begin to decline. As this happens, you may begin to have constitutional symptoms of HIV as the virus levels increase in your body. This is the stage of HIV infection that occurs when your immune system is badly damaged and you become vulnerable to opportunistic infections. When the number of your CD4 cells falls below 200 cells per cubic millimeter of blood, 200 cells/millimeters 3, you are considered to have progressed to AIDS. In someone with a healthy immune system, CD4 counts are between 500 and 1,600 cells/millimeters 3. You are also considered to have progressed to AIDS if you develop one or more opportunistic illnesses, regardless of your CD4 count. Without treatment, people who progress to AIDS typically survive about 3 years. Once you have a dangerous opportunistic illness, life expectancy without treatment falls to about 1 year. However, if you are taking ART and maintain a low viral load, then you may enjoy a near normal lifespan. You will most likely never progress to AIDS. The acronym AIDS provokes fear in many and is really a throwback from the 1980s. It was in fact coined before the disease even had a name and before the HIV virus was discovered. Prior to being called AIDS, the disease was called various other things including GRID, gay-related immune deficiency, gay cancer and the gay plague. AIDS, in common with these other acronyms, comes from a time when stigma and stereotyping of people living with HIV was rife. It may therefore be time to drop this term and instead replace it with a better one, such as late-stage HIV infection.